When we think about physical trauma to the human body, the kind that really leaves a lasting impact, like a severe postpartum tear or, I don't know, a deep surgical scar, we usually just picture this very long, very painful road to recovery.
Right, yeah. It's just expected to be awful.
Exactly. We basically just accept it. But, well, what if the secret to healing some of the most sensitive, painful, and frankly stigmatized physical traumas a woman can experience might just come from the DNA of trout and salmon?
I mean, I know it sounds like the setup to a bizarre science fiction premise.
It really does.
You imagine these scientists in a lab somewhere, like synthesizing aquatic life, but the clinical data tells a very real, very grounded biological story about tissue regeneration.
Yeah.
We're looking at a major breakthrough where aesthetic regenerative medicine is, well, it's directly crossing over into intimate women's health.
And that crossover is exactly what we are digging into today. Because, for generations, issues like severe perineal tears from childbirth or episiotomy scars, and even the intense tissue atrophy that comes with menopause or cancer treatments, they've just been brushed under the rug.
Oh, absolutely. Utterly ignored.
Right. They are treated as this inevitable decline. You're basically just told to buy some lubricant and deal with it.
Which is incredibly frustrating for patients.
Exactly. So today, our mission for this deep dive is to cut through all the noise and figure out if polynucleotides, which is this highly purified fish DNA, can actually heal vaginal tears and scars.
But to understand how a marine derivative ends up repairing human tissue, we really need to zoom all the way down to the cellular level.
Okay, let's do it.
So polynucleotides, which you'll often see abbreviated in the literature as PNs or PDRN, they're essentially highly purified fragments of DNA and RNA. And the extraction process is, it's highly specific. They are drawn from the gonads or the sperm of certain fish, specifically Oncorhynchus mykiss, which is the salmon trout, and Oncorhynchus keta, the chum salmon.
Okay, let's unpack this for a second, because my immediate thought, and probably the thought of anyone listening, is why fish DNA?
Yeah, it's a fair question.
Like, why are we isolating the sperm of a chum salmon instead of, say, extracting DNA from a plant or just synthesizing it completely from scratch in a lab?
It really comes down to three things.
Yeah.
Biocompatibility, sheer volume, and safety.
Okay.
So fish sperm, or milt as it's called, is incredibly dense with highly preserved DNA. I mean, it provides a massive extraction yield. But the really crucial part is the purification process itself.
It involves heat, right?
Exactly.
Yeah.
Scientists use this ultra-high temperature extraction method to isolate these DNA fragments.
I want to pause on that high temperature process for a second because I feel like it answers a huge safety question.
It does.
Because whenever you talk about putting an animal byproduct into a human body, the immediate fear is, well, an allergic reaction or an infection.
Right, the immune system kicking in.
Exactly. But it's my understanding that the extreme heat is actually the safety mechanism here, because heat destroys proteins, but it leaves the DNA intact, right?
That is the exact mechanism, yeah.
Yeah.
Think about cooking an egg.
Right.
The clear egg white is mostly protein,
Right.
right? And when it hits the hot pan, it instantly denatures. It turns white, hardens, completely changes its structure.
Yeah, you can't uncook an egg.
Exactly. So the proteins and peptides in fish sperm, the things that would normally trigger a human immune system, they react the exact same way under extreme heat. They're completely destroyed and inactivated.
But the DNA survives because of its shape, right? The double helix is just remarkably stable.
Yes, incredibly stable.
So even under that high heat, while the proteins are basically frying, the two strands of the DNA ladder might separate temporarily, but as things cool down, they just zip right back together.
That's a great way to picture it. You are left with a substance that is over 95% pure DNA.
Wow.
It is a purified molecular code with virtually no allergic potential. I mean, unless a patient has a highly specific, severe fish allergy.
Right, which is rare.
Yeah. And once these purified polynucleotides are introduced into human tissue, they perform this dual-action cellular mechanism that fundamentally alters how the local area behaves.
Let's get into the mechanics of that dual action. How does this purified fish DNA actually convince damaged human tissue to start repairing itself?
Well, the first step happens the moment the polynucleotides enter the tissue. They actively seek out and activate something on our cells called the adenosine A2A receptor.
Adenosine, right?
Yeah, we have adenosine receptors all over our bodies regulating different things, like caffeine blocks certain adenosine receptors to keep you awake.
Oh, interesting.
But when these fish DNA fragments trigger the A2A variant specifically, it throws a massive biological switch.
What kind of switch?
It significantly reduces local inflammation. basically pulling the tissue out of its defense mode. And crucially, it stimulates angiogenesis.
Angiogenesis being the creation of brand new blood vessels.
Exactly.
So if our injured tissue is like a chaotic, broken-down construction site, activating the A2A receptor is like hiring a crew to calm down the chaos, clear the debris, and pave brand new roads.
Yes.
So the supply trucks can actually get to the site with fresh oxygen and nutrients.
That is exactly it. You're prepping the biological site for a major rebuild. But as you said, those supply trucks need something to deliver.
Right.
And that is where the second mechanism, the salvage pathway, takes over. This is where it gets truly regenerative.
Okay, sticking with the construction analogy, is the salvage pathway the actual delivery of the raw bricks to build the new structures?
It is. So think about when human tissue is severely traumatized, say from a deep surgical cut during childbirth, or when it's starved of estrogen during menopause.
Yeah.
The local cells are just exhausted. Building brand new DNA from scratch, a process called de novo synthesis, it requires a massive amount of cellular energy.
Energy those damaged cells simply do not have.
Exactly. They want to divide, they want to heal, but they completely lack the raw materials.
So they are just stalled out. Nothing is happening.
Until you inject the polynucleotides, enzymes in the human body naturally start breaking down those long chains of fish DNA into their base molecular components, which are purines and pyrimidines.
The fundamental building blocks of life.
Right. And the damaged human cells then use this salvage pathway to literally scavenge these recycled fish nucleotides.
Oh, wow.
They grab those base components and use them to quickly rebuild their own human DNA, divide, and rapidly generate fresh collagen and elastin fibers.
So we are literally feeding our starving human cells the exact recycled bricks they need to rebuild themselves.
Yes.
Which completely bypasses the exhausting process of making those bricks from scratch. That makes so much sense.
It's incredibly efficient.
But, for anyone listening who is familiar with modern skincare or aesthetic medicine, they might be wondering how this differs from hyaluronic acid or HA.
Ah, yeah, the classic comparison.
Right, because everyone knows HA dermal fillers are used to plump up skin and lips. How is this fish DNA different?
Well, think about traditional hyaluronic acid as a highly effective but temporary sponge.
Just sponge, okay.
Yeah, HA is phenomenal at binding to water. When you inject it, it holds on to moisture and it physically plumps up the tissue. But it's largely inert in terms of cellular instruction.
Right.
It just sits there, it hydrates, and eventually the body dissolves the sponge, and the tissue is basically back to where it started.
So it's managing the environment, but it's not changing the factory?
That's exactly it. Polynucleotides change the factory. They actively reprogram the fibroblasts.
And fibroblasts are the cells that make collagen, right?
Exactly. They're the specific cells responsible for churning out the structural framework of our tissue. By feeding those fibroblasts through the salvage pathway, you're getting a long-term structural regenerative change, not just a temporary plumping effect from retained water.
Which bridges us perfectly to the physical reality of intimate women's health.
Yeah.
Because we know polynucleotides are this massive trend in facial rejuvenation right now, but shifting from smoothing out under-eye wrinkles to healing a postpartum episiotomy scar or severe vulvar lesions, that requires a bit of an intellectual leap.
It does seem like a big jump.
So how do we draw a line between those two things?
Well, we have to look at the clinical history of wound healing. Long before aesthetic clinics were using PNs for anti-aging, wound care specialists were actually using them for extreme tissue damage.
Oh, really?
Yeah. They have a really robust track record of healing chronic diabetic foot ulcers, venous leg ulcers, and severe burn sites.
Wow. And diabetic foot ulcers are notoriously stubborn.
Oh, incredible.
Because the blood flow to the extremities is so compromised by the diabetes that the tissue essentially just starts dying.
Right.
So if a treatment can stimulate enough brand new blood vessels and cellular salvage to close a chronic open diabetic wound, that is serious regenerative power.
Exactly. And the biological connection to gynecology actually lies in our embryonic development.
Okay, how so?
When a human embryo is forming, different parts of the body develop from different foundational layers. The vulva and the skin on your arm, they actually share the exact same embryonic origin, the ectoderm.
I had no idea.
Yeah. So because they're cut from the same embryological cloth, so to speak, the tissue repairing mechanism that closes a diabetic skin ulcer can be directly applied to the vulvar and perineal tissue.
So when a woman experiences a severe tear during childbirth, or she has an episiotomy, which for anyone who doesn't know is a deliberate surgical cut made through the perineum to widen the vaginal opening, that tissue heals by forming a traumatic scar.
Right. And like any DEET scar, it can heal tight, rigid, and just be incredibly painful.
It loses all its natural elasticity.
Exactly. And that's where this comes in. Clinical products using polynucleotide therapy like triple collagen, they are now being used specifically for those postpartum episiotomy scars.
So they just inject it right into the scar.
Yes. By injecting these pure DNA fragments into the rigid scar tissue, you trigger that A2A receptor and the salvage pathway we talked about. It basically commands the dense, disorganized scar tissue to remodel itself.
Wow.
The body begins replacing that rigid fibrotic tissue with softer, more elastic, healthy tissue.
You know, while I was looking through the clinical data on this deep dive, I found this really fascinating innovation from pharma research called Diner, or maybe it's pronounced Zyner.
Yeah, Geiner.
Right, and it isn't an injection at all. It's a transparent adhesive wound dressing based on DNA optimization technology, or DOT polynucleotide.
Yes, DOT technology.
And it is specifically designed to be applied externally to the female perineum to treat minor bleeding and prevent tissue damage.
Right? It acts as a physical barrier that actively feeds the repairing tissue. So instead of just covering the wound like a normal bandage, it constantly delivers those nucleotide precursors straight to the traumatized surface layer.
Wait, I have to stop you there because my immediate thought, and probably the thought for anyone listening, is going to be about infection.
Sure.
We just talked about how heat extraction purifies the DNA, but sticking an adhesive patch derived from fish directly onto an open, fresh perineal tear or a bleeding postpartum wound,
It sounds alarming.
given the location, yeah, that sounds incredibly risky.
It is a vital concern, obviously, but the high-temperature extraction process we discussed earlier really eliminates that biological risk.
Because there's no protein.
Right. The pure polynucleotides contain no active proteins to trigger an immune cascade. Furthermore, polynucleotide therapy naturally regulates the local microenvironment.
What does that mean in practice?
Well, by suppressing inflammation and encouraging rapid, healthy cell turnover, it actively helps maintain the physiological conditions you need to fight off opportunistic bacteria.
Oh, I see.
It basically accelerates the closure of the wound, which is always your best defense against any infection.
Okay, so it's literally sealing the gates faster while reinforcing the walls at the same time.
Exactly.
That makes sense. Now, to move this out of theory and into clinical reality, there is a very compelling case study from 2025 that I think pushes the absolute limits of what this therapy can achieve.
Yes, the ASCC case.
Right. It really strips away any idea that this is just, cosmetic marketing. It involves a 42-year-old woman facing a catastrophic loss of intimacy.
This specific case is just deeply revealing about the power of regenerative medicine. So the patient was diagnosed with anal squamous cell carcinoma, or ASCC.
Which is a very aggressive cancer.
Yes. And to save her life, her oncology team had to hit her with aggressive chemoradiotherapy.
And the treatment worked. I mean, she survived.
She did.
But pelvic radiation is just devastating to the surrounding healthy tissue. It completely destroyed her ovarian function, basically throwing her immediately into severe, sudden iatrogenic menopause.
Menopause caused directly by the medical intervention, yes.
Right.
The collateral damage to her pelvic floor was immense. Her medical team scored her symptoms on a clinical scale. She registered a 10 out of 10 for vaginal dryness.
Oh, man.
And she also registered a 10 out of 10 for dyspareunia, which is the clinical term for severe pain during sexual intercourse.
Which is heartbreaking because prior to the cancer, she was in a happy long-term relationship.
Right. The treatment cured her cancer, but it left her in absolute agony.
Yeah.
She was entirely unable to engage in physical intimacy.
So her doctors decided to attempt this regenerative structural rebuild. They used a specialized medical formulation called nOur.
Right.
And it combines three key elements. First, PNHPT, which is that highly purified polynucleotide technology. Second, hyaluronic acid for instant hydration. And third, they added mannitol.
And the inclusion of mannitol is just a brilliant piece of pharmaceutical engineering.
I've always wondered why mannitol gets added to these formulas. It's a powerful antioxidant, right?
Exactly.
So if the inflamed, traumatized tissue is flooded with free radicals, which basically act like microscopic scissors trying to chop up and destroy the hyaluronic acid sponge, the mannitol steps in and takes the hit.
Yes, it's a sacrifice play.
It absorbs the free radicals so the HA can survive longer and actually do its job.
Exactly. It protects the hydration sponge while the DNA goes to work on the cellular foundation.
Wow.
So this patient, she received 6 microinjections of this nOur formula into her vulva and the introitus, which is the opening of the vagina, over a period of roughly 4 months.
And the outcome is just a massive validation of the science. I mean, by her final session, her pain score started at 10, dropped to a 5.
Incredible.
And a month after the entire treatment ended, it dropped even further down to a 3. Her dryness score plummeted from a 10 to a 2. She was actually able to return to a fully normal, satisfying sexual life.
It's life-changing.
It is. But let me push back on this for a second.
Sure.
Because Nugen has hyaluronic acid in it. And HA is famously used in, like, premium lubricants and moisturizers.
Right.
So how do we know this isn't just the HA acting as an internal lubricant, just temporarily plumping the tissue and masking the pain?
That's a really valid question. But if we look at the timeline of a tissue metabolism, we can actually isolate the effects.
Okay.
Hyaluronic acid provides incredibly fast essential relief. It acts as an immediate shock absorber for those starved tissues. However, even with the mannitol protecting it, uncross-linked HA dissolves and is metabolized by the body relatively quickly.
So the sponge eventually shrinks.
Yes, it goes away.
Oh.
But in this case study, the patient's pain continued to decrease and her tissue elasticity continued to improve long after the final injection.
Ah, I see.
That sustained, ongoing improvement cannot be attributed to the temporary HA sponge. That is the distinct signature of the polynucleotides.
Oh,
Over those 4 months, they successfully instructed the fibroblasts to lay down a brand new, permanent dermal matrix. The actual architecture of her vaginal mucosa was fundamentally rebuilt.
So it's not a Band-Aid, it's a foundation repair.
Exactly.
So for you listening, if you or someone you know is suffering from this kind of tissue atrophy or painful scarring, what does the actual logistical process look like? If someone walks into a clinic tomorrow, what should they expect?
It is remarkably straightforward, actually, and minimally invasive. It's an ambulatory clinic procedure.
Meaning you just walk in and walk out.
Exactly. There's no operating room, no general anesthesia required. The clinician will first apply a highly concentrated topical numbing cream, usually a 30% lidocaine gel, directly to the vulvar area and let it sit for about 30 minutes.
Which is crucial because injecting anything into highly sensitive, already traumatized nerve endings without serious numbing would just be unbearable.
Oh, absolutely. But the lidocaine makes it highly tolerable. Once the area is anesthetized, the clinician uses a very fine needle to make a series of shallow, tiny injections around the labia majora, the labia minora, and the introitus.
You specifically mention the external vulva and the opening. Do they have to inject deep inside the vaginal canal?
No, and that's a great question.
Because even with numbing cream, a deep internal injection protocol sounds incredibly invasive and, frankly, intimidating for a lot of women.
It does, and this is a critical point of patient comfort. It was specifically investigated in an exploratory study by a researcher named Dr. Palmieri.
Okay.
The study wanted to know if you actually need to subject patients to deep internal vaginal injections to get meaningful improvements in their quality of life.
And what did the study find?
Dr. Palmieri found that a vulvar-only approach is highly effective.
Really? Just the outside?
Yes. By limiting the rejuvenation entirely to the external vulvar structures, meaning treating only the tissue located before the hymenal ring, patients still experience profound systemic improvements.
That's amazing.
They used a validated psychological and physical scale called the Personal Assessment of Intimacy in Relationships, or PAIR scores.
So by just treating the exterior entryway, basically, the women reported massive improvements in their overall sexual gratification and intimacy scores.
Yes.
Which completely lowers the barrier to entry for the patient. I mean, you don't have to endure deep internal needles to get your life back.
Exactly. It maximizes the clinical benefit while minimizing the physical and psychological discomfort of the procedure itself.
This brings up a broader question about standard care, I think. If a woman goes to her gynecologist today complaining of severe tearing pain or episiotomy tightness or menopausal atrophy, she's usually presented with 2 options, right? Estrogen creams or energy-based laser treatments.
Typically, yes. That's the standard playbook.
So why would someone opt for fish DNA over the standard clinical playbook?
Well, it's about fitting the biological reality of the specific patient. Energy-based devices like CO2 lasers or radiofrequency ones, they can be effective. But their mechanism of action relies on controlled thermal damage.
Right.
They use heat to intentionally injure the tissue, forcing the body to mount a healing response.
So you are basically burning the tissue to trick the body into sending repair crews.
Yes. And if a patient's tissue is already severely compromised, highly inflamed, or incredibly thin, Inflicting more heat damage can be agonizing,
Oh, I bet.
and the healing process is just unpredictable. Plus, lasers require highly expensive equipment and specialized operator training.
And what about hormone replacement therapy? I mean, estrogen is the classic foundational defense against tissue thinning.
HRT is life-changing for millions of women, but it is strictly contraindicated for many others.
Like the cancer patient we talked about.
Exactly. Take the 42-year-old woman in our case study who survived cancer. Many oncology protocols strictly forbid the use of local or systemic estrogen, especially for patients who have survived hormone receptor-positive cancers.
Because introducing estrogen could literally feed microscopic cancer cells.
Yes.
It's simply too dangerous.
And then there's the over-the-counter options, right? The
Right.
moisturizers and lubricants.
Right. But they just sit on the surface, they interrupt the moment, they have to be applied constantly, and they do absolutely nothing to repair the thinning walls or soften the rigid scar tissue. They just manage the decline.
Which is why polynucleotides introduce a completely distinct therapeutic pathway. They offer a hormone-free, heat-free, regenerative alternative.
That's huge.
And the downtime is virtually non-existent. I mean, patients might experience some temporary mild redness, a tiny bit of swelling, or a minor bruise for a day or two. But underneath the surface, the cellular factory has been completely turned back on.
It really is a complete paradigm shift in how we approach women's health.
It is.
We are moving away from just managing symptoms and moving towards structural restoration. Polynucleotides, these highly purified fragments of DNA sourced from trout and salmon, are acting as microscopic cellular instructors.
Exactly. By flipping that A2A receptor switch to flood the area with new blood vessels, and by delivering shipping containers full of recycled purines and pyrimidines through the salvage pathway,
Right.
they give exhausted cells exactly what they need to rebuild.
They are remodeling rigid postpartum vaginal tears. They are restoring elasticity to episiotomy scars. They are pulling tissues back from the brink of severe menopausal or chemo-induced atrophy.
Yes.
And the reason this science is so crucial for you, the listener, is because it challenges a very old, very tired narrative.
Oh, absolutely.
Yeah.
For far too long, the medical establishment has treated female pelvic trauma and atrophy as just the standard tax you pay for having children, or surviving cancer, or simply getting older.
You're just expected to suffer in silence and lower your expectations for your own quality of life.
Exactly. But utilizing biocompatible DNA to guide human tissue back to a state of structural integrity, it restores function, but more importantly, it restores dignity.
It really does. It allows women to reclaim a vital part of their lives without relying on contraindicated hormones or painful thermal damage.
Precisely.
Which leaves us with a final thought for you to mull over as you go about your day. We have been conditioned to view the human body as a machine that just inevitably breaks down, scars over, and slowly rusts. But if we can now use recycled fragments of fish DNA to literally teach the most sensitive, traumatized, and historically ignored tissues in the human body how to rebuild themselves from scratch, well, what other inevitable physical declines are we just a few DNA fragments away from reversing?
That's a great question.
Something to think about. Thank you so much for joining us on this deep dive. Keep exploring, keep asking questions, and we will see you next time.